In the health promotion paper, there were lots of very interesting information. One of the thing mentioned is the mix of health and illness. So some of the meaning or part of the meaning sometime is regarding the illness, dealing with symptom, how to treat it, and so on. But a large part of the meaning also is about wellness, things that will make you feel better for this cancer and for health in general. And basically, if your immune system is strong, you will be able to fight all kind of disease, including cancer. So a large part of and it's very interesting, people, when it comes down to diet or items about your wellness in general, people are very interested in that part also. Specifically for the people that are on active surveillance, there's lots of information that is interesting in those meetings. Yes, there is part of the conversation discuss incontinence and symptoms that you have to deal with after. Even this information is somewhat interesting for me because in 10 years, I might find myself in that situation. Getting an operation could become the solution for me in the future if my situation evolves. So on a monthly basis or every 3 months, I get my PSA tested and I make sure that it remains stable. So this information, if my PSA suddenly start to raise unexpectedly, could become very useful. But even if you still in active surveillance, there's a good part of the conversation that involves diet, even diet for people that have had an operation, and those that are trying to avoid the operation is very similar. A large part of it is not even for people with this specific cancer or cancer in general. It's good advice in general to stay healthy. If you stay healthy, it will help just to prepare yourself for an operation. It's much more easy to face an operation if you're healthy than if you're not healthy. So it's good advice in general. And this is, I think, for society in general, has become much more interesting and much more discussed in the last few years. So there's a good part of those meetings that discuss that. Even if it's not the formal part of the meeting, there'll be conversation after the meeting. People will come and ask a question about diet and say, "Oh, I discovered this new thing also." And sometimes it's a red herring. It's not always good information, but it gets the conversation going. And then you can verify things with the doctor after also, because there's a doctor there. So even if the formal part of the meeting is not necessarily interesting that day for somebody on active surveillance, the information around and the information in the library and so on, it can be very useful also. Well, for me, the most interesting information that came out of those support group was around active surveillance. Information about diet, information about the fact that some certain vitamins help reduce the likelihood of getting cancer, or help to reduce the effect once you got the cancer also. So when this information came out, made me feel more comfortable. I didn't want to just do nothing to avoid the symptom. I wanted to make sure that I took an active role to help reduce the likelihood of this becoming a very severe situation. So this information was really useful, and there was quite a bit of information and presenter that came and talked to this, and be able to talk to them after the meeting also to confirm some of that information was also very useful. When you read it, you always wonder, am I interpreting the information correctly? One of the statistics that came into one of the meetings was your likelihood of survival if you do surgery, or if you do brachytherapy, or if you do nothing, is exactly the same. So this was mind-boggling to me, and I was thinking, well, maybe there's something that I'm not interpreting right in the number. So this was repeated a few times in the meeting, and whoever the presenter was, I went back and asked them some question to confirm that, and they said yes. So just that piece of information made me feel much better about what I decided to do.